What is Lennox-Gastaut syndrome? Lennox-Gastaut syndrome, or LGS, as it's known in the epilepsy community, is a childhood epileptic disorder. It is a generalized epilepsy, which means seizures can come from all parts of the brain. You can see multiple types of seizures with LGS. You don't just have the tonic-clonic seizures, but you can also have the focal seizures, the drop attacks, the tonic seizures, to name a few. In addition to bad epilepsy, the child also has significant developmental delay. The diagnosis is made generally through the clinical history as well as the EEG. The EEG of LGS is actually pretty classic, and I'll show a few examples of it in subsequent videos. The treatment of Lennox-Gastaut syndrome is to manage the seizures. If the seizures are well managed, the progression of the disease tends to be a little slower, but this is not always the case. Often patients are also in therapies, group therapies, physical therapies, occupational therapies, and speech therapy. You can also have some behavioral therapy for patients that are dysregulated from the condition. Seizure control is usually with medications, but some people with Lennox-Gastaut syndrome can also be candidates for epilepsy surgeries. If that is the case, please speak with your doctor and they'll go through all of that information with you. And that is Lennox-Gastaut syndrome in a nutshell.